Meet Arlen, a 63-year-old with a long history of hypertension. He reports no chest pain, no back pain, and feels completely normal. Notice, Arlen is asymptomatic, but a CT reveals a bulge in the wall of his aorta measuring 4 centimeters. Additional workup, including an ECG and TEE, rule out an acute MI. Interpret. An aortic aneurysm is a bulge that occurs in the wall of the aorta, the body's largest artery. Over time, chronic pressure from conditions like Arlen's long-standing hypertension weakens the arterial wall, causing it to stretch and balloon outward. Because this weakening happens gradually and silently, many patients have no symptoms at all until the aneurysm grows large enough to risk rupture or dissection. Since Arlen's aneurysm is under 5 centimeters, management focuses on close monitoring with repeat imaging to track any increase in size, along with blood pressure control to reduce further stress on the arterial wall. Aneurysms are not typically repaired surgically until they exceed 5 centimeters, at which point emergent surgical repair with resection and graft placement becomes necessary to prevent rupture. Reflect. With careful monitoring and blood pressure management, Arlen's aneurysm can remain stable for years without complication. If left unmonitored and allow it to grow unchecked, the aneurysm risks progressing to dissection or rupture, a catastrophic bleed that occurs within seconds and is often fatal. In summary, an aortic aneurysm is a weakened, bulging section of the aorta, most often caused by chronic hypertension damaging the arterial wall over time. It is typically asymptomatic and discovered incidentally, and management centers on monitoring smaller aneurysms while reserving surgical repair for those approaching or exceeding 5 centimeters to prevent rupture. If you study to remember, you will forget. But if you study to understand, you will remember. Author unknown.